and the duration is a little shorter, but is 25 to 24 months. So it's small differences, okay? In this study of the clinical and histological study of PDLLA, the volumes were stable up to 20 weeks with no abnormalities and no migration. I don't like this study because it's in animal, it's an animal study, okay? But what explains us this study is the volume maintenance has two phases. The first phase is the increase in the volume throughout the microspheres, but the second is formation of collagen with cells, and this is the important thing, between the microspheres and inside them. This is a big difference between PDLLA and the PLLA, because as the microparticles are porous, the collagen can be constructed inside the microspheres, all right? And this is a study in human, a long term, 24 months, that is the supposed duration of the product, evaluation of the polydextrolevo lactic acid filler for nasolabial fold. It's a multi-center, open, randomized, evaluate your brain, so it's a very good study. And the conclusion, is no vascular occlusions, no granulomas, maximum improvement at 6 months follow-up, and up to 24 months result. These 28 volunteers, I think you can give a few minutes to read this study, okay? And about the case reports, in this study, this is a South Korea study, a Taiwan study in Taipei. They talk about 16,000 patients treated between 2014 and 2018, and the conclusions are that PLLA and PDLLA differ in morphology of microparticles, the reconstitution time, shorter in PDLLA, the volume of reconstitution, the nodule formation ratio, the pattern of collagen, and the longevity. But in this study, what I want to show is that there are big differences between patients and between doctors. You can see in the left of the slide a 30-year woman who received 5 sessions with 2 to 4 vials per session. At the end, they received 13 vials of PDLLA, diluted in 3 ml of water for injection and 1 ml of lidocaine, so in 4 ml. But if you see the case at the right, is a 54-year-old who received 2 sessions of 4 vials, so only 8 vials compared to the women, less vials, diluted in the same quantity in 4 mLs, 3 of water and 1 of Lido, and injected with cannula. But the next patient, a 62-year-old female, received only 1 session with 2 vials, and we can see a very good improvement. In this case, they diluted in 8 mLs, 6 of water and 2 of lidocaine. So it's not, you don't have to be worried if you don't know exactly how much vials you have to put in your patients. With every vial, they have an improvement. In a few slides, I'll try to share with you what I do with my patients, but in these clinical studies, we have a lot of differences. In younger patients, a lot of vials. In older patients, only 2 vials with big improvement. And if you check the study, they dilute from 1.4, water for injection 30 minutes before injection to 8 mLs 24 hours before injection. Okay, they only agree in giving 1 month between sessions, and no nodules reported. This is very important, and no needle plugging. Okay, and if you check what the members of the American Board of Cosmetic Surgery shows in this study, I say that there is consensus, that there is no consensus. The only consensus is in the self-massage post-treatment, in the putting of anesthetic cream before the treatments, and the adding of lidocaine in the volume reconstitution. But if you check the 410 questionnaires of the plastic surgeons of this American Board of Cosmetic Surgery, they differ a lot. 46.8% uses for HIV, 42 uses for gluteal augmentation. For the face, the majority of them use 9-10 milliliters dilution, but 60% is not a vast majority. And for body treatments, they dilute around 20-21 mLs. Okay, so again, there is no an absolute consensus in how to prepare polylactic acid in general. And this is a very, very good study about the reconstitution of the polylactic acid. They try to check what happens when we prepare two kinds of suspensions, a thin one with 8 ml and a thick one with 1.4 ml, very, very concentrated. And they check 6 different diluents. They use sodium bicarbonate, water for injection, normal saline, 0.9% of CLNA, lidocaine with epinephrine, and mannitol. And if you see this image, is very evident. At the left, the 6 squares at the left are the thick suspension. In 1.4 milliliter, you can see only letters B and F can be injected into a patient, because A, C, D, and E are not able to inject. They will give us problems. B is sterile water for injection, and F is mannitol. I don't know if you have in your clinics mannitol, but I don't have in my clinic. So what I can only use in this case is water for injection. But if you check at the right of the slide, the thin suspension in 8 mLs, all of them are injectable. Okay, you can use whatever you like, because if you dilute in 8 mLs, is good for injection. So the properties of carboxymethyl cellulose in this study play an important role forming aggregates, and it is sensible to pH variations. So it's better using water for injection, except if the cutting force is increased with the back and forth method. You know, back and forth method is this kind of three vials stopcock, three-way stopcock, connecting to syringes, and you move back and forth, and you have a good mixture. When you don't have a vortex, a vortex is a machine that can help us a lot in the preparation of the product. Let's check the products in the market. If we look Lenisna and Juveluc, they have 170 milligrams of PDLA, and in the case of Juveluc, the fourth part, 42.5 milligrams of PDLLA. But if you check, they don't have mannitol, they don't have carboxymethyl cellulose, they have hyaluronic acid. And the difference is not only the amount of the hyaluronic acid and the PDLLA. The big difference between Lenisna and Juveluc is the size of the spheres. We'll develop this in the next slides. This is a short video. Okay, what are Juveluc and Lenisna? Nowadays, we are talking a lot about hybrid fillers that combines, let's say, hyaluronic acid with calcium hydroxyapatite, whatever. Well, these are true hybrid fillers because they come from the factory inside the same vial, hyaluronic acid with polydextro and levulactic acid. Okay. This is the information you can find in the web of Bain. Bain is the company that produces the Lenisna and the Juveluc. Maybe in the distributor you can find this information, the patents, the certificates, the studies about safety, etc. But the interesting information in these brochures are the indications. As you can see, Juveluc can be injected almost everywhere, including neck, including dark circles, etc., acne scars, stretch marks. But Lenisna, as the size of the microspheres are bigger, has more or less the same indications of the rest of the polylactic acid present in the market. Okay, you have to check the prospect, the paper sheet that comes inside of the boxes, that they put the information about how much sterilized distilled water you have to put inside. But I prefer for you to use the reconstitution guides given by the company. In the case of Juveluc, you can see that if you are going to use fine wrinkles or for a skin rejuvenation as a skin booster is the perfect skin booster, or the amount proposed is around 6 ml. If you are going to inject in tear trough, they recommend 5 ml. In acne scars, they recommend 4 ml. And in the neck, they recommend 8 ml. In my opinion, everywhere 8 ml. Okay, I'll give you the information later. And in the case of Lenisna, they recommend 6 ml. Okay, in my recommendations, 10 ml. Okay, because in dorsum of hands or in buttocks, they recommend bigger dilutions like 10 ml. In breast, I have no experience. I had bad experiences with other fillers in breast, and I cannot. I'm not using Lenisna in breast, but in the rest of the body, I'm using Juveluc and Lenisna with excellent results. Another difference in the reconstitution guide is if you don't have a vortex, that's the machine you can see in the right side of the slide, you should prepare 24 hours before. The company in manual method, what they call manual method, they recommend 24 hours before the injection. But if you have the vortex, you can prepare it in 20-30 minutes before the injection. Okay, and this slide is to show you why I had more years of experience with Lenisna and Juveluc. I had the opportunity to be in South Korea in 2018 and 2019, and I was with some of the doctors who are more experienced in the using of Lenisna, and I saw what they do. They are working with Lenisna a lot of years and what they are doing.